So here we're going to be looking at the functional anatomy of the elbow and radial ulnar joints. So a couple just quick points and background about the elbow and radial ulnar joints. So obviously we know most upper extremity movements involve both of these joints. They are usually grouped together due to their close anatomical relationship. So you'll see, particularly when you look at the proximal radial ulnar joint, so there's a proximal and a distal, you'll see that it's very close anatomically to the actual elbow joint. But it is important to note that elbow joint movements have to be clearly distinguished from those of the radial ulnar joint. Okay, so they're not the same movement, and we'll be sure to discuss the differences between the two as we go through this discussion. The radial ulnar joint movements must be clearly distinguished from those at the wrist. So the distal radial ulnar joint will have obviously a close proximity to the wrist joint, but again, we have to be able to distinguish what movements occur at the distal radial ulnar joint and what actually occurs at the wrist joint itself. So when we look at the bones, so again, you can see on the illustration, you have your important anatomical landmarks when you're looking at the elbow joint and the proximal radial ulnar joint. So we're looking at the humerus, the ulna, and the radius here. So you can see the distal end of the humerus and the various components or the various anatomical landmarks. So and again, here, as I always say, make sure you know where, what angle, what orientation you're looking at. So here we're basically looking at the anterior surface of the elbow and proximal radial ulnar joint. So that's an important thing to note, because when we look at the posterior side, you're going to see some different landmarks. So the ulna is the medial long bone distal to the humerus. It's larger proximally than the radius. So if you look on this picture, you can see that the proximal end of the ulna is larger than the proximal end of the radius. The radius is the lateral long bone distal to the humerus, and it's larger distally than the ulna. So when we look at the distal radial ulnar joint, you'll see that that relationship changes. So right here, you're looking at the proximal radial ulnar joint. The ulna is larger from this view than when you look at the distal radial ulnar joint, the radius is larger. So again, the key landmarks on the humerus, we already kind of saw from the anterior side, and there's the posterior view. So again, part of when you're looking at models, are you looking at the anterior, you're looking at the posterior view. Make sure you always orientate yourself, regardless whether you're looking at a model or a picture, orientate yourself to how you're looking at it, because you can see there are some landmarks that are present in an anterior view, some that are more present in the posterior view, okay? So for instance, just as one example, you have the coronoid fossa. On the anterior view, you have the olecranon fossa in the posterior view, okay? The olecranon, as you'll see when we look at the other bones, you'll see where the olecranon process is, and that process actually goes into that fossa when you're doing that. And then the same thing over here with the coronoid fossa, but make note of the other landmarks and kind of where they all are in relation to the view that you're looking at. So here's the radius and ulna. So you can see here when you look at, for instance, so getting back to what we talked about before. So if you look at a posterior view of this, okay, so there's your olecranon process. So that olecranon fossa on the back of the humerus is where that'll kind of articulate with as you're kind of going through your range of motion. So when you completely extend your elbow, and again, feel this for yourself as you kind of just straighten your arm out or extend your elbow, you can feel the olecranon. That's actually going to go into that olecranon fossa. Over here, you have the coronoid process, okay, which corresponds with the coronoid fossa, okay? So again, these are things you want to be looking at. It'll make your life a lot easier when you're kind of, again, looking at models or having to identify things on pictures. These are the things you want to be thinking about as you're studying. Here you can see that relationship. So here, obviously, the ulna on the proximal end is much larger than the radius, and then that kind of changes when you go distally. You can see the end of the radius is much thicker than the ulna. And that'll be important when we talk about the wrist joint and kind of how the wrist joint all lines up once we talk about that in the next chapter. All right, so here we're looking at the elbow joint. So the elbow joint is a hinge joint. It has 1 degree freedom of motion. The elbow is only going to flex and extend. So the trochlea of the humerus articulates with the trochlear notch of the ulna. And again, we're only going to allow for flexion and extension at this joint, okay? So again, so we're looking at the landmarks. We're looking at how these joints come together, the relationships of the different landmarks. Again, these are all things you want to be kind of considering and organizing yourself for when you're studying. Again, your elbow motions, again, primarily involves movement between the humerus and the ulna, because if you think about it, that's the big part of the joint. Now, the radial head does have contact with the capitulum. So that is part of the elbow joint, but primarily the movement as dictated by what the elbow can actually do is going to be primarily affected by the relationship between the trochlea and the trochlear notch. As the elbow reaches full extension, just as I talked about, the olecranon process is going to be received by the olecranon fossa. That's going to increase joint stability when it's fully extended, and it's going to create that hard end feel that you get whenever you do elbow extension. So when you do elbow extension, it's a very hard end feel, and it's a hard end feel because you're getting bone-to-bone contact when the elbow is fully extended. So we got to look at the stability. So obviously, just its bony stability provides, if you look at how congruent the elbow joint is with the, particularly again, when you look at the trochlea and trochlear notch, it's a very stable articulation, but obviously there's still going to be ligaments that support it. So you have your ulnar collateral ligament on the medial side. You'll also hear some people refer to this as the MCL. So when we get to the knee, you commonly hear the MCL on the knee. It's the medial collateral ligament. Well, sometimes in the elbow, the ulnar collateral ligament is also called the MCL because it's on the medial side of the elbow. You can see it in the illustration there. It's going to provide your medial support. It's going to prevent the elbow from abducting when stressed. Okay, so it's going to prevent the elbow from going into an abducted position. Compromise from this structure often requires what's called Tommy John surgery. So for those of you who follow baseball a lot, very common to hear of this. Tommy John surgery is when they reconstruct the ulnar collateral ligament from the palmaris longus tendon. So they take the palmaris longus tendon, which is the palmaris longus is a wrist muscle. They take that tendon and actually reconstruct, much like they do with an ACL. When they do ACL reconstructive surgery, here they reconstruct the ulnar collateral ligament. Many times baseball players, again, many times because of actually compromised mechanics, things and issues at the shoulder, requires this, and they end up damaging this medial elbow ligament, and that's primarily how it gets fixed. So we have lateral joint stability as well. It's your radial collateral ligament. You can see the different, again, anatomical denotations as to where all of this is. It provides lateral stability. You also have what's called the annular ligament. So if you look at this picture, you see the radial collateral ligament. Okay. You also have this annular ligament that kind of wraps around the head of the humerus. And the annular ligament stabilizes the radial head because, as you see with movement, once we start to look at the proximal radioulnar joint, how that bony movement actually takes place, the annular ligament helps in supporting that. So here we're at the radioulnar joint. Now you have a both proximal and distal radioulnar joint. It's a pivot type joint. The radius rotates around the ulna. So the ulna, when you pronate and supinate, those are the motions that this joint does. So when you put your palm up, if you kind of have your forearm, it's easy to see it. Just flex your elbow about 90 degrees. Put your palm up to the ceiling. That's supinated. Okay. When you turn your palm down, that's pronation. What happens when you go and do that? The radius is going to rotate around the ulna. Okay, and that's an important thing to note. It's the radius that moves around the ulna. The ulna doesn't move around the radius. The ulna is going to be stationary with this movement because, again, if you look at the congruency at the elbow joint, the ulna can't move. However, the radius will rotate and come around the ulna. The shafts of the radius and ulnar are held together by what's called the interosseous membrane or syndesmosis. So it's basically a big, thick ligamentous structure in between the two bones. So this area, this space in between here, is actually filled with a ligamentous tissue. The annular ligament's going to maintain the head of the radius inside its joint. So it's just that annular ligament that we had discussed previously that will work to maintain the stability at that joint. And then we already talked a little bit about the movements before, but just to revisit them. So here's elbow flexion. So movement of the forearm to the shoulder by bending to decrease the angle. Extension, movement of the forearm away by straightening it. Okay, or basically a return from flexion. Go to the radioulnar joint. Gave some hints of this before. There's pronation. So that's an internal rotary movement of the radius on the ulna. Again, that's an important point to note. Moving the hand from palm up to palm down. And then you have supination, external rotary movement of the radius on the ulna. That puts the hand in a palm up position. So from a muscular standpoint, the elbow radioulnar joints is actually probably a much simpler joint in regards to the muscles, just because there's not quite as much movement that takes place. So you have your elbow flexors, and you can see them in the picture. You have the biceps brachii, the brachialis and brachioradialis, and then you have your elbow extensors. You have the triceps brachii and the anconeus, and you can see those in the picture as well. So we're going to talk about these different muscles, and once we get to showing you the origin insertions. With the elbow flexors, there are positions that the forearm will be in that will kind of emphasize contraction from some of the elbow flexors, and we'll talk about how, depending upon how your forearm is positioned, that will affect whether you're recruiting more or less of some of the individual elbow flexor muscles. Okay, so here we're at the radioulnar joint. So real easy to remember the radioulnar pronators, because again, the name is right in the muscle. So you have the Pronator Teres and the Pronator Quadratus. Now the trick is to remember which one is which when you're looking at these. So the Pronator Teres is the proximal muscle. You can see that here. And they're actually showing you the action and how it works if you look at each one of the individual pictures. So here's the hand in a supinated position. There it is pronated. You can see the radius going over the ulna and how that line of action is going to pull. Here's your Pronator Quadratus. That's the distal muscle. Okay. The radioulnar supinators. The biceps brachii is actually a radioulnar supinator. So the biceps brachii does both elbow flexion and radioulnar supination. Okay, and you have the supinator muscle. So the names of these muscles should definitely help with the actions, because you have the Pronator Teres, Pronator Quadratus do pronation, and the supinator muscle does supination. So again, anterior and posterior views. So on the anterior side, you can see the elbow flexors and the radioulnar pronators. So if you look at the picture on the right, you can kind of see how they all align when you're looking in the anatomical position on the anterior side. Again, feel free as you're going through this. Don't hesitate to pause this video, take your time, make some other notes for yourself as you're going through this. Again, just to really familiarize yourself with the where the muscles are anatomically. And here we're looking at the posterior side. So on the posterior side, you're going to have the elbow extensors and the radioulnar supinators. So you can see here, you can see the triceps brachii and the anconeus. Look on the back here, triceps brachii, the anconeus. And you can also, again, the supinator will also be a muscle that you can see on the posterior surface of the arm. So again, here we're going to go over origin, insertion, and action. So again, elbow and radioulnar joint, so I definitely think is a much simpler body region than the shoulder. You know, the shoulder has a lot going on. There's more motions. You know, but certainly make sure you take your time, and particularly with the individual origin and insertions. So the biceps brachii muscle, so here you see the illustration on the right, performs flexion of the elbow and supination of the radioulnar joint. You can feel this for yourself. So we all obviously know about the flexion of the elbow, but the supination, so again, you can feel this for yourself. You know, have your elbow flex to 90 degrees, put your palm down, and then just turn your hand up. You can feel the bicep shorten as you do that even more. So put your hand on your bicep with your palm down and then turn your palm up. You can feel the biceps brachii shorten. It also does perform weak flexion of the shoulder joint, and if you look at the picture, look at the origin insertions, you can see that it does cross the shoulder joint. Now, it's not a very strong flexure of the shoulder joint, but it can definitely assist with the motion via the fact that it does cross that joint. The brachialis muscle. So if you look at the brachialis muscle, it's going to perform flexion of the elbow. So you can see the brachialis. Now, again, you orientate yourself to all these different muscles. So you can see this muscle's deep to the biceps brachii. Okay, and you can see it. Now, the interesting thing about the brachialis muscle, because of the way it aligns and where it originates and inserts, they sometimes call this like the powerhouse flexor. It's basically no matter what position you have the forearm in, the brachialis muscle is always going to be working to flex the elbow. Unlike, say, for instance, the biceps brachii. Now, the biceps brachii will assist, but if you try to flex the elbow with your forearm pronated, you don't get as much activation of the biceps brachii. You could feel that for yourself. Flex your elbow with your palm up and flex your elbow with your palm down. You could feel a difference in the tone and the tension in the biceps brachii. The brachialis muscle, because of the way it lines up across the elbow joint and the fact that it originates on the humerus and inserts on the ulna, which is the more stable bone of the elbow joint, you get that is going to pretty much work no matter what position the forearm is in. Then you have the brachioradialis muscle. Again, flexion of the elbow. Now the brachioradialis muscle will tend to perform flexion of the elbow or have a greater impact of flexion of the elbow with the hand in a neutral position. So not pronated or supinated, but kind of in between. And again, you can feel that if you resist elbow flexion with your hand in a neutral position, so with the thumb up. So if the thumb's pointing up at the ceiling and you resist flexion, you could really feel the brachioradialis kind of, again, creating greater tension with that. So the triceps brachii muscle, you can see all heads will perform extension of the elbow. The long head will do some weak extension and adduction of the shoulder joint. And if you look at the long head, you can see why that would be. So the long head does have an origin on the infraglenoid tubercle of the scapula. So again, it's going to cross the shoulder joint, so it's going to have action at the shoulder joint, albeit weak action, it will still assist with that. Then you have the Anconeus muscle. That's a small muscle at the elbow. You can see it's a very small muscle, and it does perform elbow extension. So you can see the picture of it here, very tiny muscle right at the elbow. Obviously, the tricep is going to be the muscle that is a much stronger muscle because it has overall it has much larger mass to it. Here's the Pronator Teres. So again, certainly the action of these muscles shouldn't be that difficult because the action's in the name. But part of the trick with this, if you will just one be, again, obviously knowing the origin insertion, knowing that the Pronator Teres is the proximal of the two pronator muscles. And then there's the Pronator Quadratus. So you can see that's the distal muscle. Supinator muscle, again, is going to perform supination of the radioulnar joint. And again, you can kind of see the orientation. Again, take your time with the pictures. Again, I'm not going to keep the video running for minutes on this. So, again, pause, kind of look and orientate yourself to the origin and insertions as we're going through this. So again, elbow flexion, a very basic example of that is a bicep curl exercise that you would do as a part of resistance training. You have the biceps brachii, the brachialis, and the brachioradialis. Again, if you look at all this, where they originate and insert, again, the brachialis is kind of the elbow flexor that's pretty much always going to be active all the time. And the other muscles will have activity even if they're not in kind of their optimal position. But when again, if you're going to test the brachioradialis versus the biceps brachii, the biceps brachii, you're going to want to have the palm up. And again, you could feel the difference when you flex your elbow palm up versus palm down. The biceps brachii is in a much more advantageous position when your forearm is supinated. The brachioradialis has a much greater advantage when you're in a neutral position. Elbow extension, example of that would be in a push-up. You have the triceps brachii and the Anconeus. And then Radioulnar Pronation, the Pronator Teres, and the Pronator Quadratus. So again, obviously the easy thing here is going to be to remember the action. It's just going to be a matter of origin and insertion and making sure that you're not, many times students tend to just mix the two of these up because they forget which one's the proximal one and which one's the distal one. So you want to make sure that you remember that the Pronator Teres is the proximal muscle and the Pronator Quadratus is the distal muscle. And then we look here at radioulnar supination. So the agonist, so obviously we know that we have the biceps brachii and the supinator, so don't forget. And also the brachioradialis will also contribute to supination with its line of pull. So the supinator will be always the one that's easy to remember. But again, the biceps brachii and the brachioradialis will also be agonists to radioulnar supination. So that kind of wraps up the elbow and radioulnar joints. So again, your learning outcomes and objectives, again, just like all these chapters are going to be, you're looking at all of the bones, being able to identify the bones, bony landmarks of the area, any ligamentous structures that help to support the joint, so just the overall joint structure itself, and then all of the muscle origin, insertions, and actions.